Okay, we have a lot of people on, so we'll probably get going here. Good to see everyone this morning. Welcome. Happy Thursday. We have a couple presentations this morning. First of all, we have from our Arapahoe County Public Health, Jennifer Ludwig, Heather Baumgartner, and Alexa Escobar Paez, talking about the community health assessment. So I'll let you all take it away if you're ready.
Good morning. Yes, thank you. I'll get us started, and then I will kick it over to my colleagues. We're going to share about the community health assessment process that we have gone through and some of our next steps, and then really hone in on some of the data that we feel that this the Tri-Cities Homelessness Policy Group would be most interested in hearing. So I'll start off with Jennifer Ludwig. I'm Public Health Director for Arapahoe County, and really excited about where we are right now. So we opened our doors in January 2023, so last year. Next slide. And we have been going strong. We're a year and a half old now, and we opened up in 4 locations. So our Inglewood office is Bellevue and Broadway, and then we have 2 in Aurora, and then our administrative office is in Greenwood Village. The variety of programs and services at each varies, and it depends on the data we offer. Different services everywhere. We're going to be opening up a vital records office soon in Altura Plaza in Aurora, and that's for birth and death certificates. So we're hoping that we can provide a better service to those who are in that area. That's our largest clinic. So we have clinical services at Inglewood, Aurora, and South Aurora, which is Hamden and Chambers. And then our Greenwood Village is mostly administration. So huge variety of programs and services that we offer across the county. We serve all residents of Arapahoe County and visitors to ensure that we are promoting health, protecting the environment, and preventing disease. Next slide. So public health departments are required by law to create a community health improvement plan. And to start that off, we conduct a community health assessment. And this is done every 5 years, only being a year and a half old. This is our first community health assessment for Arapahoe County that is just Arapahoe County. Prior to the formation of the single county health department, County Health Department had conducted community health assessments and improvement plans on behalf of the 3 counties it served. So this is our single county plan, and we started it last year when we opened to really focus in and talk with the community, engage with our partners. We conducted a survey, and then we completed the health assessment just in March of this year. So we took our time to really engage, listen to the community, conduct the survey with our partners and the community. And we identified 6 top issues that we will discuss. We're currently in the middle of assessing capacity, because it's one thing to identify what the issues are, it's another to be able to address them and to identify who might be our partners in doing the work, and also financially being able to contribute to that. Right now where we are is in 2 weeks, we will be doing a prioritization process. If you have not received an invitation and would like to join us, we would love to have you. It's a virtual meeting on the afternoon of June 25th. In the link, and we can send this out, or you can email any one of us and we will send you the link directly to register. We would love to have your participation with it being virtual. We can hold up to as many people who want to participate. It will really help us identify what the priorities will be for the next 5 years that we will be working with community partners to address. And then in November of this year, we will launch the Community Health Improvement Plan to begin in January. The Board of Health is the entity that will be approving the final plan. Next slide. So the process that we follow is Community Health Assessment Planning System, steps. It was put into place in 2008 when the Public Health Law changed, or Public Health Act, that really organized public health departments across the state. It's a very decentralized system, but it organized us, and part of that act is to create the assessment and the plan. And we are currently looking at equity in phases 2 or process 3, 4, 2, 3, 4, 5, and then we'll be moving into 6 after we prioritize in a couple of weeks. Next slide. I mentioned that we conducted a community engagement survey. We also surveyed partners and elected officials. We had over 1,000 people participate in the survey. 67% were completed by the community residents, 11% by our community-based partners, and then 21% by the Arapahoe County staff. It included the public health staff as well as other department staff across the county government. There were three of 22 questions that helped us to get a sense of what being in a community means to people. So we're not just looking at the health data, we're also want to hear from people what they need to be a healthy community and to be safe in their community. So one question was, what do you need to live your most happy and healthy life? Second question is, what are the 3 most important characteristics of a happy and healthy community? And then the last one, what does belonging mean to you? So there's a lot of studies and information about social connectedness and how important that is to overall well-being. So it's something that we're very interested in. And hearing from the community, we heard that food, home, loved ones, friends, and a sense of accomplishment are important. Good friends and neighbors, outdoor opportunities, affordable housing, affordable food access, affordable healthcare, community events. All of these things are things that are important to our community to live a happy, healthy life. Next slide. It says we narrowed down by number of responses and the themes that arose from the survey. We came to 6 obvious areas of possible prioritization. There's no way as a community or as a public health department we can focus on all of these. We touch upon all of this, but the purpose of the community health improvement plan is to really hone in, focus efforts, focus energy, and focus resources to try to solve wicked problems. The first of the 6 is access to behavioral and physical care. Then healthy and affordable housing, huge. He's talking about housing. We're talking about that with you today. Economic security, mobility, safety, which is very broad. All of these are fairly broad, but safety mostly feeling safe in your neighborhood, feeling safe in your home, feeling safe in your work environment. A healthy and affordable food and a healthy environment. So these are the 6 areas in which we will be focusing on at our prioritization event and trying to narrow down to maybe 2, 3 areas in which we might feasibly be able to work together as a community to solve or to begin to solve. In 5 years, we don't believe that we're going to solve all of these wicked problems, but can we make a dent? What differences can we make? Next slide. So for the Public Health Department, last year, our Board of Health adopted a strategic plan that guides our work internally and externally, and is focused around an equity framework of CORE, and this is adapted by the CDC. And so we used this as our principles for developing the community health assessment, and will continue to use these principles in developing the community health improvement plan, because we believe that health equity is at the root and center of everything that we need to be doing, especially in all of the areas that have been identified. So cultivate comprehensive health equity practice, optimize interventions, reinforce and expand robust partnerships, and then enhance capacity in workplace diversity, inclusion, and engagement. So these areas will show up throughout the plan and are really core to our internal strategic plan work and our efforts and how we allocate resources. All right, next slide. We are going to jump into the data, and I'm going to turn this over to my colleague Laura Moulton. to present the data.
Hello, thank you, Director Ludwig. I'm Laura Bolton. I'm a health planning analyst, and I just want to go over some of our findings of part of our CHOP process, which is doing research and data analytics. And we wanted to bring some that would be very more relevant to you in terms of the unhoused populations in your cities. But we also noticed your team has a terrific dashboard and your interest in use of data. So I'm going to jump into the data here. We looked at factors such as income. Here we are showing a zoom in that we've created for this presentation. I just want to reassure you, we're not highlighting or singling out any cities in the community health assessment, but we wanted to provide these for you today just as a so you can see the maps of the 3 cities with dashed lines around the neighborhood. So what you're looking at here is the darker colors show a higher percentage of the population for that census tract as having an income below the poverty level. So lighter colors would reflect higher incomes. In the 3 cities, over time, there have been decreasing population percentages in populations living with poverty, including families, children under 18 years old, and individuals. And so we do see some statistically significant changes using 5-year averages in Inglewood and Sheridan. Those are here. There was no significant change over the last 10 years in Littleton. The values in the parentheses are the average percentages of families living with economic poverty from 2018 to 2022 in those different cities. We also see, when we look at the data, increases in the percentages of employed individuals from 2013 to 2022. We can also look at sources of income aside from earned income in the cities. We looked at factors like this for the whole of Arapahoe County. Here we see between the cities there are some similar levels and some differences. I do think it's important to remember that Inglewood and Littleton have 5 to 6 times the population of Sheridan. So in smaller numbers, we need to be careful on relying too heavily on census data. That is one reason that we use 5-year averages when we look at data. There have been some significant changes in the 5-year averages, and those are here in these boxes. We see, for instance, a 3% decrease in the income from supplemental security in Inglewood. We also know about the connection of mental health to economic factors, because mental health can be impacted by or impact poverty levels, and we understand some things about the relationship to the potential for homelessness as a result of and cause of reduced socioeconomic status. So a couple things to note here are that research shows that self-reported mental distress is highly related to the days of incapacity to work and medical costs. It is frequent mental health distress is a predictor of homelessness. It's an economic indicator. It can mean increased medical costs for people and can strongly relate to the days of incapacity to work. So research indicates that improving preventative structures for at-risk population and increasing access to evidence-based treatments for individuals with mental disorders are general strategies that are recommended. Getting care for frequent mental health distress, like we saw, can depend on aspects like whether one has health insurance. Here in the table, you can see the percentage of the population in each of the cities with health insurance coverage. The map is the inverse. The map, the census tracts that are the darkest are those with higher percentages without health insurance. An illness or condition that's untreated can interfere with employability, which in turn can increase the likelihood of poverty and homelessness. This data also relates to another of our prioritization categories, aside from economic security, which is access to physical and behavioral care. So you can see how some of the data here could overlap in different areas. When we're talking about housing, we looked at housing and health in our community assessment. And here we're showing the rent burden, which recent research shows can be related to homelessness. The Government Accountability Office found that for every $100 increase in median rent, they found a 9% increase in estimated homelessness rate. And so when people with high rent burdens run into unexpected issues that impact their income or expenses like job loss of transportation, or childcare difficulties, they don't have sometimes the financial padding that others have. So they may be more likely to lose rental housing, especially in areas where rental demand is high. Here in the plot, in the map, you can see the darker areas are the higher percentages where the renter households have the gross rent exceeding 30% or more of household income, which is typically the threshold for rent burden. It's around 30%. Another aspect you might look at in terms of housing risk factors is vacancy rate. People may be more likely to rent when they have lower incomes because of the increasing difference between the income and the median home value. And we've been seeing that difference widen in Arapahoe County and many parts of the country, and this can increase barriers into getting into your own home. So we have more, potentially have more renters. But it also impacts the availability of rentals, especially affordable ones. So Inglewood, in the chart here, you can see Inglewood has had a 5% increase also in the number of households from 2013 to 2022, but the other cities have not had significant changes in the number of households. So that is also reflecting not just a change in the difference of income and home value, but we're seeing some difference in population. That's what we're showing here. So these are things that can affect the vacancy rate, which you're seeing in the map to the right. And the darker areas here are showing higher vacancy percentage. So areas, neighborhoods with higher vacancy rates. The percentage of occupancy, though, has not, in the census data, has not significantly changed in any of the three cities since 2013. We also looked at some data around food security. Food insecurity not only refers to the lack of access to acquire food, but it includes nutritional quality and food safety. So in 2021, it was estimated that a relatively large portion of the population suffers from some degree of food insecurity. Poverty is a key factor that contributes to food insecurity and may directly trigger the consumption of unhealthy diets among low and middle income populations. So consequently, food insecurity and poverty not only contribute to the rise of undernutrition, but they can also increase the prevalence of obesity. Here in this map, we've combined the percentage of the census tract population using SNAP benefits, so those are the colors, with food stores, which are the red dots. Now, around the red dots, there are half-mile buffers where someone could potentially walk with groceries, but you could see that there could be, and you can imagine that there could be increased difficulty of shopping if you need to get farther to a store or carrying groceries over a half a mile without a car or on public transportation. So these are some aspects of food security that we might consider. It's, food nutrition, distance to food, the number of stores. We've also included the WIC sales here. You can see that they are an economic factor in the different cities. And then again, you can see the number of households, the percentage of households that are using SNAP or food stamp benefits. I would have one last data point here in a way to bring it together that it's not just necessarily about individuals, but that these factors of vulnerability can add to a community risk factor. And the way that people communicate about that is often social vulnerability index. And this social vulnerability is a term describing how resilient a community is when confronted by external stresses on human health. It's a way of expressing the vulnerabilities of communities, many of which are economic in nature. There may be other strengths in the communities that aren't necessarily accounted for by these metrics. The census tracts here, they calculate the vulnerability index in the different areas, census tracts from about 14 different factors. So you can see the bluer colors here have higher social vulnerability index. One of the aspects of our process has also been to do an internal assessment. Currently, the ACPH efforts include providing services to reduce expenses by helping individuals and families avoid current or future costs. And these are some of the ways in which public health does that I'm showing here. We, for instance, promote state policies with clients and the workforce that reduce financial burden for families and businesses, like the Family Medical Leave Act. There's a lot of client interaction where the staff is referring to resources and helping people get better connected to support their economic security and mobility. Other ways that we are currently working are in housing include our efforts to respond to housing related complaints, so safe housing and living conditions. We navigate people to resources, and we also do data analysis and research support like you're seeing today. So these are some of the activities that we also do. Lastly, we have efforts in affordable food. We actually have efforts in all the 6 different areas, like Director Ludwig mentioned, but I'm just highlighting some of these that exist that may be opportunities for collaboration. So there is this high level of daily interaction with clients who have food concerns, and there have also we have also designed programs that target availability and the nutritional value of food. So you can see a range of products here, and we include things like breastfeeding pumps because breastfeeding is baby's first food. It's nutrition. So you can see the range of activities we have there. I'm going to pass it over back to Director Ludwig so she can wrap it up with you. Thank you.
Thank you, Laura. I appreciate all of the information and the analysis, and hopefully this was helpful to hear just kind of a current status on the issues that we're all concerned and working on. And there was a question. Tanya may have answered. I can't see the full chat. Does the census data reflect unhoused populations well? And Tanya has answered that the census data includes some relevant information about the unhoused population, but isn't fully comprehensive. It tends to gather data on housing status, including unhoused population, but the faces challenges due to mobile nature of the group. So hopefully that answers it. Not, feel free to come off mute. We're happy, if there's time, we're happy to take additional questions. If we need to move on, Mayor, we certainly, my contact information is here. We can connect you to our fabulous data team. And before I close out, I just want to also, put in another plug for our prioritization event on the 25th, so that anybody, Heather's going to put that into the chat. Please, if you've not signed up or registered and you would like to join us from 2 to 4 on the 25th, realize 2 hours is a big commitment, but there's a lot to cover, and it's a really important meeting, and we would love to have you. So thank you for the time today, and we're happy to take any additional questions if there are any.
I think we can give a couple minutes to questions. So I think I saw Sean, your hand up first.
Thank you, Mayor, and thank you for that great presentation. It was a really good reminder in those last few slides just how much work that the health department does that directly affects the work that we do insofar as preventing homelessness, preventing food insecurity. And so, thank you for that good work. It makes me think in this, as we approach the November ballots, should the county not be able to get a tax measure approved or defroze and has to make cuts, are any of these programs at risk from the budget cuts that the county would inevitably have to make should either of those not happen?
Absolutely, and I see Commissioner Golion as well, and those are the things that we're wrestling with right now and scenarios. So public health, our budget, we are 70% grant funded. So we rely heavily on grants and contracts from the state health department. Unfortunately, any new work, unless there's a grant available, if we do not find a new sustainable source of revenue for the county, we would not be able to increase services or take on new projects unless there was a grant available. We, as public health, it is, public health departments across the state, that is how we exist, our grants. So, and we've been very aggressive in our first year of obtaining grants. Unfortunately, many of them were one time only. So as those come to an end and we're facing significant budget shortfall, we've got a bit of a double whammy. We will be looking as we prioritize these areas and identify the priorities in which we need to address over the next 5 years. That is why we will also be looking at our community partners. Who else has capacity, whether that's human resources or financial resources, to work with us, because we won't be in a position to fund it or to lead in every initiative, because the community health improvement plan is intended to be just that, working with the community to address issues, not just the public health department's plan. So it definitely could have an impact and has been weighing heavy on my mind. And we will be looking at ways to creatively finance the work moving forward, as well as looking at non-traditional partners that we haven't worked with before.
Thank you. So, you have a question as well.
Just real quick, first off, thank you very much. That was a really informative presentation. And my request is Laura, maybe share that slide presentation with the group so that we can share it with others.
Absolutely, happy to.
Thank you.
All right. Yeah, I second that. Thank you. Really informative. And we appreciate you coming this morning to talk with us. All right, we're going to move on to our second item this morning. We have Michael Norton, Ph.D., Dr. Norton, coming to speak to us about the Arapahoe County market value analysis.
Good morning, everybody. My name is Mike Norton. Thank you all very much for having us today. I'm joined by my colleagues, Michelle Schmidt, who's on the phone, and we have Rapahoe, who's also and we're going to talk a little bit about the market value analysis that we did in partnership with Arapahoe County. Maria, when you get a chance, you want to just pop up our deck and walk us through the first part. So Maria, Michelle, and I work for an organization called Reinvestment Fund. You want to go to the next slide. The Reinvestment Fund is a financial institution based in Philadelphia, which is best sort of understood as a nonprofit bank. We primarily make grants and loans to do things like build affordable housing, to build supermarkets in places with low access, to do childcare facilities, charter schools, mixed-use community development work. We do this work all over the country. Our policy group, which Michelle is part of, we work internally with our lending and grant-making teams to develop analytics that are going to help us identify places that are going to be responsive to the kind of lending and grant-making that we're to do. And then we also develop methodologies for assessing the impact of our work in places we've been active for. And the work that we've been doing with Arapahoe County is called a market value analysis, which is really designed to help understand the variation across that individual housing market. So we originally created the market value analysis to help the city of Philadelphia differentiate their distribution of $30 million populations in the city of Philadelphia. It was really designed to revitalize the neighborhoods. As this tool has evolved over the past 25 years or so, it's really taken on the life of becoming an analytic tool that cities across the country are using to help them make decisions about allocating scarce public dollars to support housing development, affordable housing creation and preservation, code enforcement, CDBG applications, all different kinds of ways that think about how they want to deploy supports for housing. And it does that by helping people understand, visualize the variation of different housing markets within a broader geography that they serve, whether that's the city of Philadelphia, whether that's Arapahoe County. And as you'll see when we get to the results of the analysis, we get this really nice mosaic of different types of markets that are differentiated by characteristics that are used to estimate how we understand different market types across the county. Here we go to the next slide, Maria. This just shows the range of places that we've worked. A lot of them are to the east, Atlantic, west. This is actually the farthest west market value analysis we have ever done, Arapahoe County. So we're very excited and pleased to connect with the ZMO team. Just about a year ago, so we've been working with them since last fall to really get this process underway. I'm going to go to the next one. And this is just an example of some of the different ways that cities, counties, and states use the market value analysis, both from a sort of directing how they deploy their resources, from a code enforcement standpoint, or a property acquisition, disposition, demolition standpoint, but also how it fits into broader strategic plans like comprehensive plans or housing needs assessments. It's a first stage in the housing needs assessment process that is going on right now in Arapahoe County. We've built into the comprehensive plan process that is also underway right now within the county. And it's also been a really nice opportunity to engage a broad set of stakeholders in the county. And you'll see as we get farther along, putting this process together really relies on integrating local knowledge into the process itself. You can see here just a high level review of what this process looked like. And so we collected a lot of data from the county itself. So we really want to rely on data that we're collecting from the county to represent the different dimensions of the housing market. We spent a lot of time driving around the county to make sure that the data that we received is actually representative of what was going on the ground. And then once we were all on the same page that the data was generally accurate, we put all of these inputs into a statistical cluster analysis, which really is a sorting team that generates the different market types that you'll see here. As Michelle will walk us through the results. But the idea being that there's consistency within each group along the dimensions that were used to conduct the analysis, and then they're distinct from every other market type that we see. And then once we get a couple of those models, we went back to Arapahoe. We drove around again all over the county to make sure that the results are generally represent the variation of different market types within the county itself. And really that process is also done in dialogue with Lizzie and her team in the county and with the steering committee that provided some insights from their local knowledge of housing markets. And you can see that group represented here as a pretty diverse set of both public and private sector actors who are engaged in the housing market and have expert knowledge on the different housing markets across the county, which, as all of you know, is a very vast space with a lot of different things going on. We'll focus a little bit today your three municipalities when we dig into the data. I'm going to just quickly give the process that we've gone through. So, Maria, you want to go to the next one? And this is, you see here, this is just the snail trail driving around the county to do the validation, but the underlying data and the results of the agencies. And at a very high level, there is very little distress in Arapahoe County. It is one of the strongest housing markets that we encounter anywhere we've been. There's very little vacancy, very little deferred maintenance, or other signs of housing distress. There's a lot of different land uses right, in Arapahoe County, as you well know, particularly when you get way out east. But even as you come towards the more populated, denser parts of the county, there's still a lot of space. There are opportunities to think about how to be using this mix of urban, suburban, and rural space in the ways that it can be used to support housing development for people at different income levels. And then it's just really diverse. The block groups themselves within block groups, right? When you get out the eastern part of the county, there's a lot of diversity within individual block groups. And you'll see a little bit of this. It's like go through the results. I'm going to pass it over to Michelle to walk you through the results of the model. Feel free as we're going to just put questions in the chat, be responsive to them as we.
So, as Mike mentioned, to build our model to understand the variety of housing markets within the county, we take into consideration a variety of sources, and we really try to use sources that we're getting directly from the county that are up to date and that are fresh, on a quarterly or daily basis. So I just wanted to let you know there's the three kind of categories that we think about: property values and investment, and kind of distress and vacancy, which we found was very low across the county. And then other types of neighborhood characteristics. So these are things that aren't necessarily strengths or weaknesses. They just tell us a little bit more about the block group. And this was a particularly important group in this work in Arapahoe County because there is such a variety of land uses, such a variety of landscapes. And so that was a really important grouping for us as well. Next slide, please. Can you put that? Perfect. So what we do is we take all of those ingredients and we put them into this sorting algorithm called a cadence cluster analysis, and it creates these groupings that are internally very close to each other. So if you have a C market in one place and a C market in another, they would be very similar. But if you have a D market right next to a C market, that there would be a difference between those two block groups. So it really helps you just understand what the mosaic of all of the different housing markets look like. The kind of big takeaways that I want you to hold with you as you walk through the next slides are that most markets are majority owner occupants. So most people are owning their homes, with two exceptions, and those are the D markets, which is a middle market, and the I market, which is a more affordable or accessible market. And then the second point is that the C markets that you'll see in blue are mostly in the rural eastern half of the county, so where you have a large share of land that's agricultural. And we'll be talking about that much during this presentation since we're focused on the western half. But did just want to point that out that that's one specific category that's important in this analysis. We also had F and C markets where we found that that most of the homes were built after 2000, so places that are experiencing more growth and getting more built out. And again, we won't see either of those two market types very much in the Tri-Cities, mostly because we're focusing on parts of the county that filled out pretty well already. And finally, that the G markets, which you'll see in orange, those are places where 88% of the rental units are subsidized. So they're places where you don't have that many renters, but the renters that you do have are using a rental subsidy of some kind. So whether that's living in purpose-built public housing, using a housing choice voucher, living in low income and what type of housing that was built for that purpose as well. So next slide. So just to kind of quickly give you the overview of the county, you'll see that eastern half that's in that blue, which is that rural market, really just occupy the eastern half of the county. Then we look at more populated areas, particularly we'll see those more accessible markets that are in Aurora, and then we see in that dark green those areas that were built up more recently. And then if we focus on the left-hand side, to the west, we'll see the Tri-Cities area. We're going to zoom in closer on those going forward, but I just want to point out that there really is an enormous variety of housing market types across the Tri-Cities. Really see, I think we see everything except for those C markets. those rural markets. So next slide, please. So then just giving you an idea of what those, just to drive that point home, that we do see a variety of market types across the board. That for most of the that in the Tri-Cities, the kind of most common markets that we're seeing are those B markets, which are very strong markets where the housing market, where the median housing price is above the average and home ownership is high. We're seeing D markets, which is a middle market that has a higher share of renters. Then we're also seeing E markets, which are those another middle market where mostly homeowners, where the housing stock tends to be a little bit older than the F markets. And then we see the G to I markets, where they're more affordable, more accessible to potential homeowners and current homeowners. And again, that G market is going to be places where we see higher shares of subsidized renters. Next slide, please. Okay, and I'm going to pass it on to Maria, who's going to walk you through deep dives into each of the three cities.
Great, thanks, Michelle. So we're just going to be walking through like a series of maps here, kind of zooming in on the three different Tri-Cities. So the first one here that you see is Englewood, and you can really see like what Michelle mentioned earlier, just kind of the variety of different market types that you see both within Englewood and just outside of it. And you can see that it's bordered by these like very strong rural markets. There's a B market located within Englewood. Just outside of it, you see an H market here, which is one of the more accessible market types within Arapahoe County. You see a G market made up of subsidized renters, a variety of like E and D markets. Within Littleton, a similar story can also be seen here, where you just kind of see the gamut of really strong markets, steady middle markets, renter markets, which are these like D, light blue areas, as well as just outside the city boundaries, F, C's, and G market within as well. For Sheridan, you can see here the market types that you really are seeing are G market, E market, and H market. So the E markets are one of the largest market typologies that in our cluster model. There's 139 block groups. Within the H markets here, these are areas that are pretty accessible. They are just slightly more owner-occupied at 60%. And G markets, again, have a high share of subsidized renters. We're going to be walking through some overlays now. So we think it's something important to provide additional data points alongside the market to kind of just show where strategic intersections kind of exist when you consider housing affordability, commuters or job centers, and supermarket access alongside the MBA market types. So the first one that we're going to go into is housing affordability. And this is kind of considering a different population outside of homeowners, looking at just kind of what are the costs that renters face within these MBA market types. And just looking at a breakout here, across Arapahoe County, more than half of all the renters in these more accessible markets like F, G, H, and I use more than 30% of their household income on rent. When costs for rent exceed more than 30% of a household income, it can really limit their ability to afford other essentials like food, transportation, and healthcare. So it's something important to consider when these households are facing increasing cost burdens. And just kind of providing an overview here. So you'll see the chloropleth, like the underlying data that's kind of shaded from yellow to like a reddish orange, kind of shows the share of renters and their cost burden within that block group, where you see like really high concentrations, like over 60%, so more than half of renters that are cost burden over these like dark orange and reddish areas around here. And we thought it was important to highlight where those intersections happen with the GH and I markets, because it tells us something about, accessible these markets are, but how it can be a different experience for renters and the affordability challenges that they face. So just zooming in for Englewood here, you kind of see a very wide variety. You'll see renters here who are facing super high housing costs, something around 20% or less than 20% of renters there. But then you see within, here at the top, just outside of it, just at the south here as well, renters that are, over 80% of renters are cost burdened, where their rent exceeds more than 30% of their household income. For Littleton, a similar kind of patchwork of different renter experiences can be found here. And where there's like GH9 markets, you'll see that this long block group here that borders that houses the park has a share of renters that's around 60 to 80% of cost burden. And just north of the city as well, you'll see a very high proportion of renters are cost burdened. For Sheridan here, you'll see a really good really clear intersection of GH and I markets. This is an H market, if you remember from the MBA map that I showed earlier. That's over 80%, so 80 to 100% of renters, really all the renters in that area are cost burdened. And just considering these, the Tri-Cities kind of compare to other cities within Colorado, you'll see that they're in line with rates that you'll see in Denver, or Boulder has a pretty high share of cost burden renters as well. Centennial is one of the lowest within Colorado at 38%. So the next set of data that we'll consider are these commuters and job centers. So looking at data set called Ph.D, which kind of looks at where workers are located, where their jobs are located, and where the residents live. So here, just providing a look again at the wider Arapahoe County area, we overlaid the Ph.D as kind of this like heat map over the MBA archetypes to just kind of show where these intersections lie. You'll see right here around Glendale, there's a pretty high concentration. And this is specifically looking at jobs that are low to moderate income, so jobs earning less than $40,000 a year. And you'll see there's a pretty high concentration of those jobs just here in Glendale, this Denver Tech Center area, as well as just north of the Cherry Creek State Park, where the color gradient kind of turns more orange red indicates like a higher concentration of those jobs, and where it's more green, it's a lower distribution or clustering of jobs there. And again, just providing a zoom in for the tri-counties to kind of see what trends are happening there. You'll see an input here, just this kind of interesting job cluster happening in this D market, which you can kind of see if you look a little bit underneath the heat map here. And what's interesting here is that it's kind of bordered by these purple markets as well as this H market here. So, it kind of implies that this D market is kind of operating as like a job hub for people that not only these the neighboring groups around it can go access, but also for renters who might be looking for jobs at this income level who can actually maybe reside close to where they work. For Littleton, you see a concentration again within the D market, bordered around by these pretty strong markets here, as well as another cluster down at the bottom. So you're seeing this kind of local economy happening here, where people more like in these areas here where there's not as high a concentration of these low moderate income jobs, people are probably driving and accessing this area here to access the goods and services provided by the people who work jobs in this area. This kind of patchwork here that you see, it implies that just because of the variety of, different income levels that might exist within a G market, within an F market, within H, and the A B markets as well. And finally, for Sheridan, which tends to be more residential, you'll see a pretty even distribution, but there's not too many jobs at this income level located within here, more outside the area, just kind of covered by the legend here. And what's interesting about this G market kind of not having any kind of color there, there's probably a low concentration of jobs there, which implies that people residing within this block group are more likely, traveling to their job more than they're working within their neighborhood. And then just looking at higher income jobs here, so you'll see that it's a similar concept. So we're overlaying the Ph.D. data, specifically looking at jobs where people are earning more than $40,000 a year. And you'll just see it's a more intensified scale. So this Denver Tech Center just really lights up with, most high concentration of high income jobs there. Similarly with Glendon, and you'll see the Tri-City areas kind of having a little bit more activity than we saw in the previous map. So in Echowood, you'll see a concentration of high income jobs again in that DI block group. The job activity is mostly along the western edge of the city here. For Littleton, you'll see a high concentration of jobs again in that D market, bordered by the A and the D markets, to the east and the west of it. And it's, just highlighting an economically diverse area that is attractive to high wage earners. This kind of new heat, kind of like new orange area that's kind of popping up in this map shows an area that's kind of a major job hub for Littleton. This is an area that in our previous maps was kind of shaded out as like non-residential, so it's more than likely just an area where a lot of jobs are concentrated in. And then finally for Sheridan, you'll see too, you're seeing more of like the yellow tinge, so a high level of high income earners. Again, but a more even distribution than in the other cities, mostly just probably due to the fact that there's just a low density, a low level of jobs in this area, but more activity for high income earners as well. And again, you see that cluster just outside the city limits kind of popping up right behind this legend here. And then finally, just looking at like where do Arapahoe County residents work, you'll see that across all the different market types, most of the Arapahoe employed Arapahoe residents work either in Denver, which is about a third of Arapahoe residents, or other parts of Colorado, so outside of Arapahoe County itself, which is a share of 33% share of the residents in Arapahoe. I'll just be passing it back over to Michelle to just talk about kind of the intersection between the MBA and food access.
Thanks, Maria. I realize that we're close to time, and so I'm going to just be very quick with this, and we are going to send our slides over so that everyone will be able to have them so you can take more time with this, on your own. And we're always here. Our emails are at the end. You can always ask us for additional information. So just quickly, we kind of go forward. We do an analysis looking at access to supermarkets. So it's really just limited to looking at the proximity to the supermarket, full access, full service place. And so we have a couple of different categories that we use. And what we found in the Tri-Cities area, at least, is that proximity to supermarkets didn't pop up as a big problem. But as was mentioned in the first presentation, that proximity to food is really just one component of food access, right? You also have to be able to afford it. And as we see these rising home costs and rising rents, it can really impact a person's capacity to purchase food. And so I'm going to just leave it at that and toss it back, unless there's any questions, just because I know that everyone is busy and has things that they get back into. So you can, but you will see this additional information along with some case studies and some places that have done a good job of relieving any kind of food access issues that we found across the country. So you'll have access to them as well.
Great. Thank you so much. I know we're out of time. Glad to hear we're going to get the slides because that was a lot of information to digest. So look forward to going through those, and we'll let everybody go because I'm sure everyone like me has another meeting coming up. But thank you all, and we'll see you again next month. I appreciate your time. Bye.
Thanks for having us. Thank you.